The beauty of being at Imiloa is like 90% of our campus is open air. So, as we've learned with science, like over the last 2 years, the exposure and transmission rates are really low when there's fresh air involved. So, where you dine, there's open air. Where you sleep, there's open air. Where you're learning and facilitating and participating in workshop, there's open air. And then in addition to that, our team is taking extra precautions. So they're wearing masks, they're wearing gloves when they serve food, like all the extra things. So I think just thinking about it from like, if I'm going to travel and where would I be the safest? I think being outside in a jungle and fresh air environment is probably one of the best places you could choose to be if you're going to travel, during COVID. So we have a couple things that we're doing, and I'll start by saying everything that we've designed is in the spirit of keeping our team and our retreat participants and hosts safe as possible, and looking out for everyone's well-being. So the things that we're doing right now, and this is current for the months of January, February, March, is we're requiring everyone before they come to Imiloa to have a negative COVID test. And we're doing that so that we can get a baseline for everyone when they're entering the campus. And it can be done a few different ways. We're accepting antigen and PCR tests. They can be done at your doctor's office, at a clinic, at a pharmacy, hospital, outpatient facility, or we are also accepting at-home tests that are witnessed by a medical professional with a license. So that could be a doctor, a nurse, a pharmacist, et cetera. And it's really easy. You get your test. We have a Google form that is sent to everyone before they attend the retreat. You upload your information and proof of your COVID test, and then you're good to go. And then when you're on campus, we do kind of a secondary process, which is everyone does a self-report temperature check in the morning. And you just log that in our health log. And then if someone does experience a high fever or symptoms where they are not feeling well, we have tests on campus where we can test people. And then obviously if it's a negative test, that's one outcome. If it's a positive test, we have a procedure so that they can get the support that they need and to get an official lab test. With the COVID situation, to travel to Costa Rica, you're not required to be vaccinated. And so what that means with travel is if you are a vaccinated traveler, you'll fill out a health pass. You'll provide proof of your vaccination. And once you do that, you get a green check mark on like your phone screen, which essentially tells you you're eligible to board your plane, and you'll present that when you go to the airport to travel. If you are unvaccinated, the Costa Rican government has a health insurance policy requirement. And what that means is, in addition to your own healthcare from whatever country you're traveling from, you need a policy approved by the Costa Rican government that will cover you for COVID treatment and quarantine accommodations. And there's a couple ways of securing that. One way is you can ask your health insurance provider to give you a letter saying that they will cover you for that, if that's something that they do. And the best way to do that is to visit the Costa Rican travel website. So if you're gonna do that, you can just Google traveling to Costa Rica from America, and it'll be the first website that pops up, and it'll give you all of the guidelines for that. The second thing you can do is purchase an insurance policy that's approved by the Costa Rican government. They list, I believe there's 6 of them, 5 or 6 of them on their website. And if you purchase one of those policies, it automatically fulfills the requirement of the Costa Rican government. So you'll purchase that policy, and then you'll fill out, just like someone who's vaccinated, you'll fill out your health pass, and you'll get that green check mark because you have the insurance that you need, and then you'll be able to board your plane. The health pass is something that you fill out online. Most airlines will send you an email prior to traveling asking you to fill that out. If not, again, it's something you can Google, which is, health pass to enter Costa Rica, and it will come up. So what would happen is if someone tests positive for COVID on campus with one of our at-home tests, either we have a doctor that comes to campus to administer the official test, or if they're not feeling well, we would take them to the clinic where they would also get an official test, and there's medical care available. Once someone tests positive with an official lab test, it's actually reported to the Ministry of Health here. And there's the Ministry of Health basically then puts you into the official process of quarantining. And that can be done a couple of different ways. And so it's really on a case-by-case basis. But if someone's at Imiloa and the exposure has been low, and they're in a single room, we would let them finish most likely quarantine, like their retreat in quarantine at Imiloa. And then we would help them get transported back to San Jose privately, where they would finish their quarantine in a hotel. If there's an exposure risk for that person because they're traveling with other people, staying in shared accommodations, then we would have to address it differently. And there's some important factors there around things like when you quarantine in Costa Rica, you're allowed to move locations one time. So we would look strategically at whether we want to, when and where we need to move that person. But the goal was always to get people back to San Jose into a hotel where it's comfortable to quarantine and where they're close to. San Jose actually has two of the best hospitals, like, you know, in the world, as far as healthcare goes. So then they're also close to excellent medical care. So yeah, I mean, I think the thing that I would say to people is like, you know, we're in like a really interesting situation, you know, in the world right now with Omicron. And I, you know, as far as people taking like the necessary precautions and really just thinking through their travel plans, if you plan and think it through, I think it can still be a really smooth process. And if there are things that happen like travel interruption, late arrivals, those types of things, that's something that Imiloa is completely dedicated to supporting people on. And one of the benefits of us putting people on a charter flight to come to our campus is that that flight doesn't leave anyone behind. So we're able to accommodate like late arrivals and things like that. So there is a security in that people will get to Imiloa even if they do have travel delays.